And it's good to see you. As you recall, the purpose of your visit today is to acquaint you with the vertebral subluxation complex. This will help you understand the nature of your care. This is a very important visit in your care. We take this report very seriously. I require the same seriousness and cooperation from you during this report and during my recommendations, all right?
Yes.
Lynn, my optimum goal is to keep you healthy for a lifetime if you choose to do so. However, there are 3 types of chiropractic care. The first is called initial intensive care. This is the beginning type of care designed to reduce or eliminate the symptomatic problem. It consists of relief care and stabilization. What this means in your case is relief from your headaches, which is what brought you to the office. Or if you focus on vertebral subluxation, we're going to reduce and stabilize the most recent damage of your vertebral subluxation complex. Your case history revealed that you have a number of spinal-related accidents that could very well set the stage of malfunction and damage necessary to cause or contribute to your headaches. Or if you focus on the vertebral subluxation, your case history revealed that you have a number of spinal-related injuries which have caused the vertebral subluxation complex in your body. Your physical examination revealed various areas of malfunction and weakness that I will cover in detail in just a moment. The second type of care is reconstructive care. This continued care is designed to correct the vertebral subluxation complex and reestablish your health. The vertebral subluxation complex is a condition in which the spine has been injured, damaging your nerve system and overall health. It consists of 5 components. The first component is called spinal kinesiopathology. Take a look at the first picture on the vertebral subluxation complex chart that I have right here. Component 1, spinal kinesiopathology, meaning damage to spinal function. The illustration on the left shows a fairly normal spine from the front view. The illustration on the right shows a damaged spine with joints that have been injured and not corrected. In this case, they are fixed or have worn excessively and are too loose. There's even degeneration in your case, Lynn. The second component of the vertebral subluxation complex is called neuropathology. Let's look at the second illustration on the chart. Component 2, neuropathology, is the damage to the nerve system caused by the improper function of your spine. This nerve damage can be seen as mostly irritated or pinched nerves. The illustration shows what happens when a slight degree of pressure is applied to the nerve on a laboratory animal. It is just a matter of 2 to 3 minutes of function of the nerve is reduced by 60%. See, this is the normal nerve and this is the damaged nerve.
Okay.
It does not take much to damage nerve function. In your case, with the damage to your spine, as I've outlined it, there is a great deal of nerve interference throughout your spinal column, which controls all the functions of your body, thus causing your entire body to malfunction, setting the stage for increasing weakness and illness. The third component of the vertebral subluxation complex is called myopathology. Myopathology is best illustrated in the third picture of the chart. Myopathology means that the muscles have been affected, either in form of spasm or sometimes to even muscle weakness. Notice illustration how this muscle on the left is in severe spasm and the muscles here on the right are weak. The fourth component is called histopathology, best illustrated in the middle row of pictures. The histopathology is mostly inflammation and swelling that sets the stage for degeneration of muscles, ligaments, discs, and even bone tissue. These 3 pictures are of the side view of the lower spine. Note that the normal forward curve is present. However, also note how swollen the front of the spine is from here to here. That's the result of long-term histopathology. The discs are even ruptured out of the front of the spine. This next illustration is even worse. See the swollen areas of scar tissue. The last picture is very bad. See how thick the tissues have become in front of the spine? The bones are very badly degenerated. All of the areas of recent and past uncorrected spinal scar tissue weaken the spine, degenerate its function, and make it more susceptible to further injury. Remember, many of these injuries do not cause pain at the time that they happen. The fifth component is pathophysiology. This is a result of the previous 4 components if they go uncorrected. This component is the ill health of the entire spine and body created by the vertebral subluxation complex. This last row of x-rays, subluxation degeneration, clearly illustrates spinal ill health from vertebral subluxation complex. Let's compare your x-ray with the ones on the chart and determine what phase your spine is in. Notice the bones on the first x-ray are smooth and regular. Your x-ray reveal that your bones are rough and irregular. In phase 1 of subluxation degeneration, there is a misalignment and improper motion with no observable degeneration. Your x-ray also shows misalignment, and my exam revealed improper motion. However, in addition, you have a great deal of degeneration here and here. Uncorrected, phase 2, the beginnings of degeneration occurs. You have much more degeneration in your spine. Uncorrected, phase 3, in which case there is a great deal of degeneration just like yours. And in phase 4, there is total fusion. Of course, your bones are not yet fused. Lynn, in what phase of subluxation degeneration do you think you are?
Maybe a 2?
I think you could be a 2, maybe a 3, and Lynn, according to my physical examination finding, my opinion is that the top part of your back is in phase 2 and the lower part of your back is in phase 3.
Wow.
You will probably ask me if this can be fixed. Actually, I will be attempting to fix this. I will be correcting the subluxation, and then the only real healer, your body's innate intelligence, will reestablish health and heal what has not been permanently damaged. You can expect that the subluxation complex is influencing your subluxation degeneration phase. Your lifestyle and compliance with our recommendations will also affect this. Under reconstructive care, phase 1 usually returns to normal function. Phase 2 usually returns to normal function, while the current subluxation degeneration may remain but stop getting worse. In phase 3, there should be a significant return to function. However, the degeneration may only expect to slow down. Phase 4, only those areas of the spine not at phase 4 can respond to care. Certainly, as the function and health of your spine improves, the function and health of your nerve and whole body will improve. The third type of care is wellness care. It is designed to ensure maximum neurological, spinal, and body wellness for a lifetime. In your case, Lynn, my recommendations for initial intensive care are the following. Your initial intensive care should be complete in about 6 weeks. At that point, we will re-examine you, evaluate your case, and see how you have done. I will give you another report, and we can determine what your next step will be at that time. We do require that our patients here pay that at the initial visit, and because it will require less of our office and less for us to do, we do give a lower price if you would like to pay up front for the month. So either you can pay $50 cash a visit, or you can pay $280 for the month, which will make the adjustment be $40 a visit, and you can come in twice a week. This will cover your corrective care for the first month. We do not take insurance at this office. If you would like to be referred, then I can also help you with that. Lynn, should you wish to continue with reconstructive care after your initial intensive care is complete, we have a well-patient care-free system that makes it affordable. Shall we begin?
Yes.
We get the unique opportunity to work with a variety of patients in achieving their health objectives, so that we may better assist you and create a participatory environment in which to fulfill your health goals. You need to identify what type of care you desire. Should your goals change, let me know.
Okay.
Would you like initial intensive care for relief, or would you like initial care and spinal neurological reconstructive care?
I think the second one.
Okay, so if you would like to go out into the front desk, we can schedule you for the next month and we can get this care going. It is very recommended, and I really encourage all of my patients to come to my healthcare class. I hold them every Sunday and every Tuesday from 2 to 4. And this will help you really understand the vertebral subluxation and really understand why you're having the symptoms. Because for a lot of people, they don't really understand. And subluxation is just a word that, they hear a lot of chiropractors saying, and they don't fully understand their symptoms. And a lot of the times for other people that aren't educated as much, their symptoms can be understood after they understand something like an iceberg. The tip of the iceberg are all your symptoms, and it's, they're smaller and they're pointy at the top, and then at the bottom it's bigger and thicker, and under the water is really what's giving you your problems. So you have to understand that we have to address the bottom of the iceberg so that we can take away those symptoms at the top that are being produced. Your body is a self-healing organism, and once we recorrect your spinal malfunction and your degeneration, then the pressure on your nerves can be released, and by coming to my healthcare class, I can increase your understanding of the term subluxation and why a chiropractor like me can help you perform at your best ability, and your whole life and health will be in better condition.
Well, thank you, doctor. It's very interesting.
Of course. Dylan at the front desk will be talking to you, and you can make an appointment, and they'll take care of the financial obligations that we talked about out there. Have a great day.
Thank you.